You may be thinking to yourself, I'm struggling right now. Maybe you're watching and you're there and you want to get help.
I want to acknowledge the need. The next question often is, who do you turn to for help? That can depend on what you're struggling with.
And this morning, joining us live is Kevin Rand, an associate professor of psychology at IUPUI, also a practicing therapist. It's so good to see you. I want to start with a message that I just got from Ashley, who said this: mental health care is health care and it should be covered, not $400 a month with insurance. This is one of the things that we've been getting a lot of feedback, Daniel and I have this morning, is just how expensive it is to get help. Is that one of the factors of why people aren't getting help, or one of the biggest, or do you see that's not one of the biggest issues?
It certainly is a hurdle for many, but the biggest issue right now is I just don't think we have the capacity of mental health workers to handle the demand. So most places are booked full and don't really have any openings for people to get help.
And Mr. Rand, when we talked with you this morning, who do you talk to if you need counseling for things like work stress or relationship problems? And there's a gamut of issues.
Right. So for general life issues, there's a whole bunch of options. You can talk to licensed clinical social workers, licensed mental health counselors. You can talk to psychologists. There's even coaches and marriage and family therapists that you could talk to for general life stressors.
Yeah, and Kevin, what if you then have a more serious issue? Maybe there's something, a specific problem. Maybe you've been told to give a personality disorder. Maybe it's serious anxiety that's causing severe panic attacks.
Right. As it gets up into the clinical realm, then you want to seek out help from someone who's been trained clinically. So that would be licensed mental health counselors, licensed clinical social workers, or psychologists who are trained in very specific techniques to deal with things like clinical anxiety, post-traumatic stress disorder, clinical depression, etc.
And when you're being diagnosed with those things, when are you interested in trying the medication?
There are medication options for several things, such as anxiety, depression, can help with schizophrenia, can help with bipolar disorder. If you're interested in medication, then you need to seek out the help of either a psychiatrist or a psychiatric nurse practitioner.
Kevin, we sure do appreciate you joining us to talk a little bit about that, and hopefully we'll be able to get more information to those that are watching this morning. If you do think that your child has ADHD or your parent is starting to forget things, who do you talk to in that realm?
In that case, you want to see a clinical psychologist who they're licensed to give tests and make diagnoses based on those assessment results.
All right, Kevin Rand, Associate Professor at IUPUI, we really appreciate your time this morning. Thank you.